With respect to the IT infrastructure in India, I don't believe that the infrastructure that's in place today is sufficient to be able to handle the bare minimum needs of data. Electronic communication, email, electronic records, those are very, very small files. But when we start looking at technology, we start looking at PET scans and CT scans, scans that may be 10 gigabyte, 40 gigabyte in size, we simply don't have IT infrastructure in place to be able to move those files quickly and to be able to move those files accurately. The result is that doctors and nurses are waiting for files. That's called slow time. Networks may be auto-negotiating down to slower speeds. We may even realize downtime. We can calculate the cost of that downtime and slow time. In the Indian market, that cost is about $1 per minute every time we have to wait for information to move. So my opinion is that the network infrastructure here in India needs some significant upgrades. Presently, the IT spend is about 9% compound annual growth. In my opinion, that needs to be almost double, 18 to 20%, I think is going to be what's needed to support with the healthcare growth in this market. The IT bottleneck lies in two places depending on whether you're talking about an existing infrastructure or a new infrastructure. With existing infrastructure, it's very difficult to do retrofit. It's very difficult to get into spaces where patients are present, where perhaps infectious disease are present. So we find it's very difficult to perform upgrades on the existing infrastructure, which may be Category 5E or 100 base T rated, simply too slow. For new infrastructure, I find that the bottleneck is related to lack of planning. We are finding that the technology trend is not only to support digital imaging and digital medicine, but also to support intelligent buildings, solutions like intelligent lighting, LED lighting, digital signage, digital patient services. So we're underestimating the amount of cabling that needs to go into each hospital or patient room, and to some extent, we're not putting in the correct grade of cabling. It needs to be a minimum Category 6A shielded to support video technology, both for entertainment and diagnostic medical services. I am astounded as someone from the United States looking at India's objective to be one of the top 3 healthcare providers by the year 2020. So when I look at hospitals that are targeting that objective, these hospitals are talking to IT companies such as the Siemon company, who I work for. They are learning about structured cabling standards, and they're beginning to start installing the correct grade of cabling to support this technology. I think that the cities in India are extraordinarily progressive. They get technology and they understand how to build technology into healthcare services. The lag is really related to reaching the rural Indian population. Right now, 70% of the population is in these rural areas, but only 3% have access to specialized healthcare. So the lag is finding a way to reach the rural population. It looks like the best solution is going to be some sort of mobile technology, which is a giant leap forward, but it's still not the level of technology that we need to be able to do digital imaging, and to some extent robot surgery and advanced technologies to take care of these people that are in difficult to reach areas of the country. I think to some degree hospitals are underestimating the importance of cabling. A hospital is like a Ferrari. It's fast, it's high technology, But if the hospital fails to consider the pathways that the technology travels over, it's the same as Ferrari forgetting about the roads. So I think when it comes time to design a healthcare infrastructure, the thought is definitely high-end cabling is required. There's an awareness there. But when it comes time to approving the budgets for this technology, if there's a budget cut to be made, the folks that are controlling those budgets don't understand the importance of cabling, and often the cabling is downgraded. And actually the cabling is the most important aspect of the IT infrastructure. So I think it's a lack of awareness on the people that are controlling the budgets, which causes some of the cabling technology to be less than satisfactory.